I'm a Brazilian neurologist. My name is Cicero Coimbra, and I'm interested in the pathophysiology of brain death. What I have to say is that the practice of diagnosing brain death is no longer supported on scientific grounds, especially for two reasons. First, because all brain functions that are tested during the diagnosis of brain death can disappear when you have only 50% of decrease in the brain circulation. Formerly, we believed that the absence of brain function would imply absence of brain circulation, and now we know that the circulation is only decreased to 50% of the normal blood flow. And this decrease is not enough to cause irreversible brain damage. However, when we induce apnea test, when we stop breathing, prevent patients from having the aid of mechanical ventilation for up to 10 minutes, we may cause death. We may cause irreversible brain damage rather than diagnose irreversible brain damage. The second reason why the current diagnostic criteria are no longer supported on scientific grounds is because all those patients are suffering from endocrine disorders. For instance, nearly all of them are having decreased production of thyroid hormones. And thyroid hormones are known to stimulate the respiratory function. So the absence of thyroid hormones will cause apnea. Those patients will not breathe on their own in the absence of thyroid hormones. Another problem is that the thyroid hormone has also regenerative functions in the brain. The absence of thyroid hormones can increase brain edema. The brain will swollen in the absence of thyroid hormones, and that will render the brain edema, which is the cause of brain death, to be unresponsive to any other therapy. So actually, when we diagnose brain death, we are inducing irreversible brain damage in patients that never had the opportunity to receive proper treatment, which would be proper replacement of hormones, and also they had never the opportunity to get the benefits of induced hypothermia. Hypothermia is capable of decreasing brain edema, normalizing intracranial pressure, and restoring the brain circulation to normal levels. So when we are testing patients for brain death, we are actually killing patients or inducing irreversible brain damage rather than diagnosing brain damage. In addition, those patients had never the opportunity to receive maximal therapy, and this is happening all over the world.